Well, it's great to be with you here today, Mavis. I'm excited about our topic today.
Oh my gosh, me too. So this topic, it's a mouthful in of itself. Oral facial myology. I mean, as a
Orofacial. Yeah. So
oral
we are
facial,
about orofacial
yeah,
myology. And just to
yeah.
myself, I do a lot of posts about my health coaching work and about my herbalism work.
Mhm, mhm,
And I haven't yet really dove into this other thing I do. I've been a speech
mhm.
therapist for the last 20 years, and I recently got really into orofacial myology, and I still practice it. And I work out of Hillsborough, North Carolina, where I see clients for orofacial myology, and not everyone knows what that is. So it's
Right,
super like a canary in the coal mine. So I'm excited.
right, yeah. And even as a healthcare provider, I have like little knowledge about what it is, which is why I'm super excited to talk to you about this today.
Mhm.
All right, so let's go ahead and get started. First of all, what is it? And can you kind of break it down for people like me who have no idea what it is? What is orofacial myology?
I call it orofacial myology because I really like that. I think it really encompasses what it does more. So other people might call it myofunctional therapy, but it's the same thing. And essentially, sometimes speech therapists, sometimes dental hygienists will do it, even occupational therapists. Lots of different people do it. You just have to have the training. And what it is we work on proper resting posture of the tongue in the mouth. We work on nasal breathing. We work on proper swallowing, chewing, speaking, lip seal, that the lips should come together at rest. And all of this impacts also the vagus nerve. So essentially, we're working on that. We're working on proper breathing. And each of those can be broken down into more. So nasal breathing. Why is that so important? Because when we breathe with our mouths closed and through our nose, we produce nitric oxide, which is an odorless gas, hugely important in immune support, in neurotransmitter, cognitive functioning, memory, endurance, and insulin sensitivity, delivering oxygen to the cells
Yeah,
so much. And experts say that about 80% of people breathe wrong. And
I'm sure.
it's
Yeah.
true. I'm sitting there at gym class, and I look around at people and I'm always like, oh my God. The teachers aren't necessarily knowing either. So, like, there's just a lot of not understanding of proper breathing. So we
Yeah.
definitely do a lot of work with that. And then swallowing. So I just tell you a personal story, Mavis, is like before learning about orofacial myology, I thought I chewed and swallowed fine.
Yeah.
Like I didn't know anything dysfunctional about it. Then I
Yeah.
learned this therapy and realized I haven't been chewing and swallowing fine.
Mm,
So it gave me a lot of insights that sometimes I will accidentally swallow food without properly chewing it.
hmm.
And, then we have overcompensations that the body does, right? And so it does matter to chew and swallow properly. Um, Tongue posture is hugely important. A lot of times we deal with people with tongue restriction called tongue tie, ankyloglossia, and you don't really know honestly if you have it unless somebody who knows can evaluate you and properly and tell you how restrictive it is. But essentially, if your tongue isn't lightly suctioned to the roof of the mouth throughout the day, and especially when you're sleeping too, um, then it creates all sorts of issues, malocclusions, crowded teeth, right? And people might say, so what? Just get braces. But
Hmm.
braces Band-Aid, it doesn't fix the dysfunction, and oftentimes the teeth will move after because people didn't do myotherapy. Um,
Mm.
Also, everyone these days, Mavis, I don't know, like if you have one, or have been prescribed one too, but like night guards,
Mm.
like
Oh, I don't use it, but yes.
me too. Okay. So I'm curious as to why you don't use it, but basically with night guards is it's a band-aid. It doesn't treat the dysfunction. It also causes other issues. It causes jaw like misalignment. And when it's in the mouth, it's hard, especially if it's on the upper, it's hard to have space for the tongue to rest where it's supposed to rest.
True. Yeah.
Um, and the lips can't close all the way, right? It's adding like this other thing in there. But we do have an issue, right? You have to learn not to grind your teeth. You have to learn how to have your tongue in the right posture, which is what we work on.
Yeah.
And then lips, if your lips aren't closed, then you're also creating issues. And all of this creates like, we all as a civilization have like narrow airways and just weak jaw muscles and receded chins and all these issues. And, you know, it's because of myo that we really all, honestly, we all have a myo issue. It's just more about how big is your issue and is it worth solving. And then the vagus, 10th cranial nerve, hugely important, as you know, for the gut brain highway. And guess what? Your tongue is supposed to be lightly suctioned to the roof of your mouth to stimulate the vagus nerve. So,
Oh,
go on
interesting.
and on. But
Yeah.
that's what we do in a nutshell.
Yeah. Yeah. Wow. That was a lot. Thank you. Thank you. And you know, it's so interesting. And I've just, as I've gotten older, realized how important this part of your body is and how much it controls. And just, you know, last couple of weeks ago, I was talking to my husband about this because we just started mouth taping like literally 2 weeks ago. And I was trying to convince him to do it. And he thought, you know, he was like, what do you mean? And then when he started doing it, he started seeing a difference in how he felt. I have an interesting question for you. Maybe you don't know the answer to this, but why is it that, and me and my husband were talking about this, why is it that we all have these issues? Is it because our diet has changed over the years, like as through evolution?
So I want to answer that question and then just go back to what my opinion is on mouth taping. So,
okay, yes.
As orofacial myologists, we do not advocate for taping directly on the lips. We advocate for taping around the lips.
Okay.
Because that's a more gentle way of like retraining yourself to, rather than forcing it. So it's less obstructive. And so I just wanted to say that, because for some people that could actually be dangerous too if you have enlarged tonsils and you don't, or and have another way to breathe. But yes, I do advocate for around the lips. So
interesting. Okay.
yeah. And then you were saying why? Such a good question. So I'll offer a great book for as to why. This book by James Nestor, Breath. It's going to appear backwards, but that is a really good layman's book for understanding why. Because he really talks about how as civilization has progressed, we've become eating more softer foods and not working our jaw muscles as much.
Okay.
Our diets are like smoothies and oatmeal and, you know, chicken. It's like, this is all soft. You know, and so you really have to work your jaw muscles. I do agree. I also think it's really important to be able to chew the food properly. So it is about that, also chew properly, which is why we do therapy. But yeah, like essentially we've also just learned these wrong ways of breathing as civilization has progressed, which is causing a whole bunch of those other, you know, those other issues that we're seeing. And so he studies cadavers of, you know, like really old people and saw how, wow, like they have stronger jaws and stronger muscles and how we have just changed. And, you know, people didn't have crowded teeth back then, right? So it's like, we've also, all these, it's like the canary in the gold mine, because when you have these issues, they lead to other issues like sleep apnea, poor posture, airway obstruction issues. So people, they don't realize like how, having proper resting posture of the tongue and all that actually does affect all those other things and leads to things like apnea and posture issues.
Oh my gosh, it's so fascinating. So yeah, no, I'm glad I got to ask you that because we were just talking about that. How do you work with someone with sleep apnea?
So we aren't allowed to say we cure sleep apnea, but basically we work on essentially, it really depends on why the sleep apnea is occurring, I should say. So for sometimes people have sleep apnea because they need to lose weight. And when you have more mass here, like that will cause issues for breathing. Sometimes it's because of chronic mouth breathing, which leads to sleep apnea. So there's different reasons as to why someone could have it. But essentially, we just train the person to breathe out of their nose. So we do exercises to train a person to breathe out of their nose and have proper resting posture of the tongue, which would improve sleep and, you know,
Yeah.
improve.
Yeah. Yeah, no, that's awesome. I'm thinking about like realistically what you're saying. Like we have learned so many quote unquote bad habits about this, which most of us have learned and practiced this our whole life. So when it comes to treating something like this, what does that look like and how long does that take to kind of relearn or unlearn past habits?
Good question. It really depends on how severe and what the person's issues are. I haven't even talked about all of it. Like, for example, some people can also have TMJD or temporomandibular jaw dysfunction, which is like clicking, popping, grinding, which we did mention about the night guard. Um, so there's lots of things that a person could be dealing with symptomatically. If you are grinding at night, you might wake up with headaches in the morning. So there's that. So it really just depends. But essentially going from A to Z through a myo program, which is what it is, you know, typically we see somebody typically like once a week and maybe 6 months, give or take, and maybe longer. So at minimum 6 months and lots of times longer to be able to
Yeah.
incorporate breath work and also retraining and doing. And that would include practicing daily exercises for
Yeah.
retraining your, yeah. And so just a personal note is I'm also working on it. Like I need it too. We all need it. So do you want to know? Well, I mentioned my swallowing issue. So here's the thing. When we chew and swallow, right, we chew on our molars, right? And then, well, after we bite, we bring it to the molars, chew it, right? Then we make something called a bolus, which we is like a cohesive form of ball of the food where we move it to, you know, posteriorly on the tongue, initiate swallow reflex and swallow. So I skip that step.
Okay.
So I basically swallow from my molars. I don't bring them over. And what skills do you need to be able to do that? Well, I have trouble like making a bowl out of my tongue. It's like a,
Hmm.
right? So we have different muscles in our tongue, and
Mm-hmm.
the muscle that you need to be able to do that is the superior longitudinal intrinsic muscle. So mine is weak. And so I'm retraining myself to be able to um, you know, do things where I can use the lateral, because you need the lateral borders and the tip of the tongue to move food.
Yeah.
I'm training myself to use the lateral edges of my tongue. And someone else might use with a different muscle of their tongue where we work to strengthen that. So yeah, it's fascinating. And I think I love it so much because I know it's the canary in the gold mine. I know how important, like I came to it because I knew there were issues people were having that I couldn't help them with.
Mm-hmm.
And that is huge. So now when people come to me for health coaching, they're usually like, and I need the myo too, you know, and it's like I just have to decide, well, where are we going to start? What's the most
Yeah.
important place? Where's the most important place for us to start now?
Right.
That's really impacting that person, you know, the most. And posture,
Yeah.
like
Yeah.
who knows where your tongue rests in your mouth affects your whole posture. So
Yeah. That's wild. Now, wait, so you were talking about nitric oxide at one point, and a couple weeks ago, I was at a conference learning about how important nitric oxide, particularly when it comes to hormones, which is, you know, something that I work a lot with. So super important for hormones. So can you talk a little bit more about that? Where can people learn more about that?
Uh, I think just a good layman's book, which I feel like a lot of people know about this book and have read it. I don't feel like it pays homage enough to my profession and how we help people, but it definitely draws a lot on the problem of, you know, that we're not breathing right and that our muscles are all just, you know, the function isn't there and all that. So I really like Jane Nestor's book, Breath. It's a New
Oh,
York Times.
perfect. Okay.
I mean, it's like, I see it everywhere. Um,
Mm-hmm.
and I think that's a good starting point. There are other books depending on like what area the issue is, but this stuff even affects speech. Like people who have lateral and stuff, it's also because oftentimes because of myo. Yeah, and it's quite amazing how people's posture improve, like, and the whole
Wow.
face actually changes.
Yeah,
If you,
this is what I hear, the face structure.
yeah,
I think it's just like fascinating. And I'm thinking about all the things I've had done in my life and about how I don't, I don't wear my weight. I do grind, but I don't wear my neck guard. And I've had braces and I've had all these things. And I'm just like, no wonder the mouth taping.
yeah. So I've also had braces, and I also tend to grind, and I'm working on it. And I have to tell you, like, yeah, I mean, it is definitely, it's like almost an epidemic. I feel like every other person has it. One thing
Mm-hmm.
to look at is when we do an evaluation, we look at the palate,
Mm-hmm.
and we look like how, is it narrow? Is it like, because the palate has to be large enough for the tongue, wide enough, I should
Mm-hmm.
say, tongue to be able to rest where it needs to rest. So we work together with orthodontists and dentists
Oh,
who
yeah.
are airway informed to be able, and ENTs and stuff, to just be able to make sure that there's enough space. So a lot of times kids will get like palate expanders if they're getting braces as well. I have, but it's harder as an adult to expand your palate, than,
I
than
bet.
yeah.
Yeah.
So
Oh,
yeah, that's
man.
an aspect of it as well.
Oh, my goodness. Oh my goodness. So it sounds like almost like you said, 80% of people, almost probably everyone's a candidate, but who specifically is a good candidate for this therapy and who is not?
Good question. So a person, well, so traditionally in speech therapy, where we work a lot, or I used to work a lot with kids, for example, on the autism spectrum or
Mhm.
Down syndrome, all that, you have to be able to follow directions to do this therapy. It's not easy, right?
Yeah.
So cognitively, people who can and not have like behavioral issues around that, people who can follow directions and follow through with homework. Harder with kids to follow through with homework, but yeah, you do have to do these,
Mhm.
and we try to make it fun and all that. We
Mhm.
only work in myo with kids who are 4 years old and older, truly, like to do a true myo program. I personally see kids who are like 8 years old and older
Okay.
because my office is set up for young ones, but you can
Mhm.
definitely for, and then we're also working on eliminating negative oral habits like thumb sucking,
Okay.
which create bad bites and all that. So, and open air, like open mouth postures. Anyway, so yeah, so that would be, and adults definitely. And so people who are dealing with snoring at night, that's not normal. That has to do with airway. So like snoring, sleep apnea, waking up with headaches, TMJD or jaw dysfunction. People like that are good candidates. Yeah, a lot.
Okay. Yeah. Oh, go ahead.
Yeah, it really depends. Have to be, you know, in a position where you're willing to do the work, I guess.
Right. Yes. Yep. You get out of something what you put into it, right?
Yeah.
So let's talk a little bit about the results you see. And just personally, like one of the patients and clients that we shared just recently had a really good success with their blood pressure, remember? So with I think it was with mouth taping and working with you. So tell us like what are some like, we everybody likes a subjective, what are the subjectives? I mean, what are the objectives? So blood pressure, what are some other things that you see numbers wise or just in clinical improvement?
Yeah. So, blood pressure is often associated with mouth breathing at night, and your sympathetic nervous system is activated, and you like, then you have to go pee all, and it's like,
Mm-hmm.
um, we want to get into that parasympathetic rest and digest state. So basically, yeah, your people who have high blood pressure, a lot of times that is because of mouth breathing. So you improve the breathing,
Mm-hmm.
you do nose breathing, and the blood pressure you notice comes down to normal, which is what we had with our shared client. So,
Yeah.
and great is like I proved it to her is like she mouth taped and didn't mouth taped, and we checked her blood pressure, and she was like, oh, like it was just when when you
Yeah.
see then yeah, I went
Right.
from like 140 to 122 over what it
Amazing.
was, but it was normal. Um, yeah, and another thing you would see, like I said, postural changes, improvements, and whole face structure improvements, bite improvements. I mean, just swallowing and chewing improvements, speaking improvements, headaches going away, having more energy during the day, so many things.
That's amazing. So many things. And then the whole tie with the vagus nerve too. So I'm assuming that that would also then kind of like make you maybe feel more calm or more relaxed just because
Yeah,
the body feels like you said, it's not in that fight or flight response. It's like able to relax and get some good rest. So that's amazing. I will say with the mouth taping, and again, I've only done it consistently for the past 2 weeks. But I feel less brain fog when I wake up. That's a big
yeah,
one for me.
awesome. Yeah, that's awesome.
Mm-hmm. Yes, it is awesome.
Yeah,
I'm very happy about that.
so increased
Um,
attention. So you're bringing me to a good point. Is improper breathing or mouth breathing is also correlated with ADHD, and it's correlated with we'll see symptoms like bedwetting with kids and stuff like
mhm,
that.
mhm,
Really has to do with breathing. We also see a
yeah,
lot of like large tonsils, and
mhm,
I know that ENTs oftentimes will want to remove them. As a health coach and as someone who has a health background, I always encourage first doing some dietary changes, especially getting rid of dairy is huge, so huge. I didn't. I had chronic tonsil issues, and I didn't. I just didn't know, and then
right,
as an adult, I found out I was lactose intolerant. You know what I mean? So that was another improvement.
yeah,
Uh, oh, we'll also see lots of things like growths in the mouth. We call these tori or ostosis. These like bony projection growths, and to us, that's we know how to look at the mouth and know like, oh, these are signs. Let's just say of mouth breathing, because you might not even know what you're doing or if you're doing it right. Um, or
mhm,
those are signs of grinding. Um, yeah,
mhm,
so we would see that. Whereas like we might see like inflamed gums. That's another thing you see oftentimes with mouth breathing.
mhm.
Um, yeah, it's just so much.
Oh my God.
We might see
Yeah.
scallop tongue, which shows us that the palate's too small. I mean, it's just a lot.
Oh yeah, I have the scallop tongue, and I imagine too that you work as you're talking. I'm thinking like you probably work with biological dentists. You probably work a lot with them too because of like hidden infections. Because like I recently just got over treatment for a hidden infection in my mouth, and then I'm thinking, okay, how much inflammation did that cause my mouth, and then how did that affect everything that you're working with someone on? It's so intricately connected. Yeah.
It is. I think biological dentists are amazing. The issue always is that they don't take insurance, and
Yeah.
people,
Yeah.
it's hard with this society right now and wanting to
Hmm.
um, get care from
Yeah.
holistic people.
Right.
But yeah, biological
Sure.
is awesome.
Yeah. Yeah, very, very, very grateful. Want to be respectful of your time. I don't know if you want to talk about anything else, but if not, definitely, how can people reach you? How can they do a consult with you? Do you do them in person, virtual? What's all that look like?
So myotherapy virtually. I personally like to do it in person, at least starting off. So I'm located in Hillsborough, North Carolina, and you can go on my website and watch a quick video on Myo if you want a little bit more information, although we covered a lot in this talk. And you can, connect with me with a free consult and we can discuss what's going on with you and if it's worth going to that next step. And then the next step would be a thorough evaluation. And then after the evaluation, if therapy is recommended, then we continue with therapy. It might not be, I don't know.
Right,
So really just
right.
depends. Um,
Yeah,
it might be, that you need to see an orthodontist first or an ENT first. I don't know. So
right,
yeah,
right. But
yeah.
yeah, but
So
you
the
can guide them.
mhm,
Okay.
mhm.
I love that you do free consults. Did everybody hear that? Free consults. This woman is amazing. She's a genius and she's offering free consults. I mean, this is like, it's like we just, it's like the Christmas present.
Oh, thank you. Yeah, it's a
Mhm.
pleasure to be working with you and share on this topic I'm really passionate about.
Yeah, no, thank you so much. This has been awesome.
Thank you. Mavis. So wait, our next live is April what?
It'll be the last Monday, if you can do the
So
last Monday.
Monday, April 28th at
Yes,
12 p.m. We're going to be talking to Mavis about hormones.
yes, that's right.
See
All
you
things
then.
hormones. Have a good
Bye.
one.
Bye, you too.